Hello, today we'll be studying about beta blockers. To begin with little summary about what is adrenergic system and cholinergic. So we know that adrenergic is also called as sympathetic system, and this is mainly important during the emergency condition where you are under stress and pressure, and it is also known as flight and fright reactions. Wherever in case of emergency, tachycardia and increase in the heart rate, your glucose levels will increase in the gluconeogenesis. All these will happen during this sympathetic activation. Parasympathetic is mainly tissue building or your process reactions where there will be storing of urine and like those reactions or those things which are to be done calmly is all done during the parasympathetic system by the parasympathetic system. And the important neurotransmitters of the sympathetic systems are the adrenaline, noradrenaline, and dopamine. These are the three important neurotransmitters of the sympathetic system. Okay, adrenaline, noradrenaline, and dopamine. These are the three important neurotransmitters, and they mainly act by the various adrenergic receptors which are classified further as alpha and beta. The alpha is further classified as alpha 1 and alpha 2, and beta is further classified as beta 1, beta 2 and beta 3 receptors. Okay. Likewise, dopamine has 5 subsets from D1 to D5. So in brief, I just wanted to highlight what you should understand to know in depth regarding the beta 2 blocking action. So that is why just to understand. So beta 1 is mainly present in the heart, okay, and in the juxtaglomerular apparatus of the kidney, okay. In the heart, what it does is it is GS, cyclic AMP mediated. So it will increase the heart rate, okay, increase the force of contraction, and it will on the through juxta glomerular apparatus mediated action, it will increase the renin. By all these, it will increase vasoconstriction, heart rate, and contraction, force of contraction. All these will cause hypertension, that is increase in the BP. Beta 2 mediated, it is also present on pre and post synaptic bronchi, okay. Beta 2 bronchi, coronary artery, uterine and other smooth muscles, and also in the myocardium. With this, what it does is it will release norepinephrine and epinephrine, and it will cause relaxation of the smooth muscles, meaning there will be bronchodilation, vasodilation in the blood vessels, causing blood vessels will get dilated, okay. Uterine relaxation, all these will happen, and myocardial also relaxation, myocardial vasodilation, okay, all because there is where this beta 2 is present, okay, and there will all be dilation. This is the normal action of beta 2. So also it will increase the glucogenolysis, meaning it will increase the genolysis. More amount of glucose is available. Glycogen is converted to glucose, and it will also increase the heart rate, force of contraction as beta 1. So these are the actions of, these are beta 2 mediated actions. Beta 3 is mainly and only present in the adipose tissue and on the post synaptically at the uterine dextrosar muscle. Okay, urinary bladder dextrosar muscle, but this have minimal action. We hardly study about these things. So beta 3 if it is as mainly you should tell in the adipose tissue, and it is involved in the lipolysis and thermoregulation. Uterine, we have vasoselective things, and this will help in urinary increase in the urinary retention. So today's class was about beta blockers. Beta blockers mainly means those which will block the actions of beta 2 mediated catecholamine action. So to study this, you should first know what are the drugs which are blocking beta 2. So the classification goes like this. There are two ways of classifying. One is like generation, and there is one more other classification which is in the next slide. So we'll finish off with this. So generation wise classification is it is classified as first generation, second generation and third generation. based on the receptor selectivity. So first generation is also called as non-selective. Each of these terms are very important. First generation is also called as non-selective beta blockers, and they involve propranolol, okay, timolol, sotalol and pindolol. They are non-selective first generation beta blockers. And then second generation, or also called as beta 1 or cardioselective, because we have seen already beta 1 is mainly present in the heart and extracellular operators of the kidney, but main action is through heart. Okay, so they are metoprolol, atenolol, acebitol, bisoprolol and esmolol. They are second generation, which are cardioselective beta blockers. And the third generation is with additional alpha blocking property and or vasodilatory property. Every word is important, I am telling you. So with alpha blocking property, labetalol, carvedilol. Okay, carvedilol, celiprolol, nebivolol, all these also have uh, vasodilatory property because they release nitric oxide. Okay, this is also very important. So this is generation wise classification. And he also told previously it was classified like this: non-selective, which is having action on beta 1 and beta 2, and cardioselective, which is beta 1. In this further we have something called as with and without intrinsic sympathomimetic activity. This is also important. Why? We will study those in the further slides. Without sympathomimetic activity is propranolol, sotalol and timolol. With sympathomimetic activity, pindolol. Okay. With additional alpha blocking property, I already mentioned, it is labetalol and carvedilol. Okay. And cardioselective is like your second generation drugs, that is metoprolol, atenolol, acebutol, bisoprolol, esmolol, betoxolol, celiprolol, nebivolol. Okay, this is another way, but your book mainly now gives according to generation wise. Okay, so we have seen there the actions of beta agonists. Okay, so we'll see what happens with beta antagonists. I have not mentioned everything, I have just mentioned what is important. Okay, so on the heart, there we saw it was all increasing, right? So beta blockers will decrease the rate through and force of contraction. By this, the heart cardiac output also decreases, and thereby BP. All these are mediated mainly by beta 1 and beta 2 mediated action. Mainly this decrease in heart rate and force of contraction, heart cardiac output, all these are beta 1 mediated actions. On the respiratory smooth muscles, beta 2 beta agonists was causing bronchodilation. Consequently, beta blockers will cause bronchoconstriction. So blockage of beta 2 receptors in the bronchial smooth muscles will cause bronchoconstriction. Okay. So they cause bronchoconstriction, and this can precipitate an acute attack of asthma. So you should always have caution when you are giving beta blockers in case of asthmatic patients. And on the eye, they decrease the aqueous secretion, and this is one of the important causes why it is used in case of open angle glaucoma. Okay, thereby they decrease the intraocular tension. So adverse effects, so beta blockers, so we have seen the action. So beta 1 mediated decreasing the heart rate, so it can cause bradycardia, one of the important side effects, bradycardia. Okay, and impaired myocardial function. That is why this is contraindicated in cases or in case of heart block, and it can also precipitate congestive cardiac failure. Okay, and warning signs in case of peripheral vascular disease and cold peripheries, because they cause vasodilation, right? So that is why you have to take a precaution. And it is also contraindicated in asthma, as we saw. It will precipitate an attack because it will block the beta 2 adrenergic receptors in the bronchial smooth muscles. So coming to the uses, so there are 10 uses in this, and I have marked 5 in the red and 5 in the green, right? So this first 5 is also called as cardiac uses. Where all it is used? It is used in case of hypertension. It is used in case of angina, okay, arrhythmia, myocardial infarction. All these are heart conditions: congestive cardiac failure and obstructive myopathy. Okay, all these are heart related diseases. So they are all called as cardiac uses of beta blockers. They will be asking questions like this. That is why I'm stressing upon it. So cardiac uses, first one is hypertension. So I have told the action how it is helpful. Beta 1 and beta 2 mediated decrease in the heart rate, force of contraction, vasodilation by blocking the beta 2 beta 1 action, beta 2 mediated vasodilation in the blood vessels. So all these are the mechanism how it will decrease the BP in case of hypertensive patients. And next one, in case of prophylaxis of exertional angina, to prevent or precipitate an acute attack, it is through studies known that the severity and frequency of attack is reduced, and also it will decrease the cardiac output, that is cardiac workload, and oxygen demand. That is why beta blockers are preferred in case of angina. Prophylactically also, if it is given, it is known that it will decrease the severity and recurrence rate. And next use in case of arrhythmia, because there is increase tachyarrhythmias, they will decrease the heart rate, right? So that is why it is one of the classes of antiarrhythmic drugs. Class 2 is mainly beta blockers. So they will decrease the heart rate in case of arrhythmias, tachyarrhythmias mainly. And also it is one of the drug which is given intravenously with close monitoring in case of myocardial infarction and congestive cardiac failure and obstructive myopathy. They will decrease the oxygen demand, and it is and in case of prophylaxis to prevent, they are also given in case of congestive cardiac failure and obstructive myopathy. Obstructive myopathy is a condition where there is increase in the cardiac smooth muscles, and the ventricular cavity is decreased. Ventricular volume will get decreased in case of obstructive myopathy. In those conditions also, we can give beta blockers. So these are the 5 important cardiac uses of beta blockers. Moving on to the non-cardiac uses. So it is used in case of pheochromocytoma, which is a tumor which is associated with adrenal gland, right? So there will be increase in the BP, heart rate, and it is an emergency condition. So along with alpha blocker, this is given to decrease the BP, and also to prevent during the surgeries of pheochromocytoma, where we remove the benign tumor. So there can be pouring of this catecholamines, resulting in increase in the BP and all these symptoms. During that condition, to prevent hypertension, we give beta blocker. Next, use in case of thyrotoxicosis, which is also one of the important non-cardiac uses of beta blocker. So it is used as an adjuvant therapy, where it will prevent the symptoms, that is palpitation and tremors. Also, it will prevent the conversion of T4 to T3. That is peripheral conversion is also decreased in case of thyrotoxicosis. And anxiety, that is mainly performance anxieties, it is where it is used to prevent the vicious sympathetic cycle. So it is used in case of acute panic symptoms, that is tremors and tachycardia. To prevent that in anxiety, beta blockers are also used. Timolol, the important beta blocker which is used in case of open angle glaucoma, because they decrease the aqueous secretion and decrease the intraocular pressure. It is also used as a prophylactic treatment in case of migraine. So this is also one of the non-cardiac uses. So these are the important uses of beta blockers. Coming to the important drug interactions of beta blockers, very important this is. The first one is in case of diabetic patients. So you should never give propranolol along with insulin or other hypoglycemic agents. Or if you give also, you should have a close monitoring because of two important reasons. The first one is it will mask the symptom of hypoglycemia. Uh, that is tachycardia, which is a first sign of hypoglycemia, that is masked in case if you give beta blockers along with insulin, mainly non-selective, that is propranolol. And one more important reason why it should not be given is it will prevent uh, glyconeogenesis, as we also saw in the actions of like beta blockers, that it will increase glucogenolysis, right? So the breakdown of glycogen into glucose. In case of hypoglycemia, you need glucose, right? So that is prevented when you give propranolol. Okay, so this will result in like increase in the time required to recover from the hypoglycemia. So these are the two important reasons why you should avoid propranolol along with insulin. And the next contraindication is with verapamil. It should not be given along with this calcium channel blocker because both will cause decrease in the heart rate. Propranolol through beta-1 mediated bradycardia and calcium channel blockers also decrease the heart rate. So there will be profound depression, that is why it should be avoided. Beta blockers plus catecholamines should also not be given because mainly this is with non-selective beta blockers because there will be upregulation of alpha receptors resulting in intense vasoconstriction. So this is mainly seen when you give adrenaline in case of local anesthesia. Usually that is what is practiced, lignocaine and adrenaline, to increase the concentration of local anesthetic at the desired site. So some amount, which is very minute amount, even if it enters into the blood, and that can cause severe vasoconstriction, and that is why it should be avoided. So if in case of these patients, if you want to give also, it is always safer to give plain local anesthetics like only lignocaine. So we all have already known that you have to be cautioned in few cases, and or other in other words, it should be contraindicated beta blockers in case of bradycardia, patients who is having bradycardia, and patients with heart blocks. Okay, it will further decrease the cardiac workload, and in case of asthmatic, because it will precipitate an acute attack by causing bronchoconstriction and also COPD, similar to asthmatic patients. So in these patients you should never give beta blockers. Hope you understood. So here are few MCQs. So 4 MCQs I have mentioned. So most important action of beta blockers in glaucoma. Why we use beta blockers? Is it because of membrane stabilizing or retinal neuron protecting effect, or it will decrease the aqueous humor? So answer is this, decrease in the aqueous humor. So likewise I have mentioned few questions. True statement about esmolol. So if you go through the slides, you can answer these questions. Thank you.